Welcome to this brief video demonstration of the virtual patient information leaflet. My name is Stephen Chapman. I am Professor of Prescribing Studies and Head of Medicines Optimization here at Keele University. Over the next couple of minutes, I'm going to demonstrate to you how avatar technology, which you may have seen in clips of The Cave, etc. before, can be used to empower patients. So I want you to imagine a scenario. You've been to your doctors and you've had news about a condition that's disturbed you. It could be cardiac disease, respiratory disease, cancer, whatever. You've had your consultation. There's information flying all around your head at the moment, hasn't quite settled down. You get back home, it's 7 or 8 o'clock at night, and you've still got questions. The doctor's now closed. The pharmacy's now closed. The internet's full of all sorts of information that you can't filter. Wouldn't it be brilliant if you could use your smartphone or your iPad to ask your medicines what they can do for you? And actually, this is what we're going to do. So what I've got here is a native app installed on my tablets. This could have happened in the doctor's surgery, in the hospital, or in fact, it could have been installed for me when my medicine was dispensed at the pharmacy. Because it's a native app, it's not dependent on Wi-Fi. And what I'm going to do is load this up, then scan it against this dummy inhaler here. If you look there, you'll see the inhaler has a QR code on it. We're doing this for copyright reasons. The QR code is not necessary. It will recognize any pack. So if I start the demo.
Hello, my name's Stephen. Like you, I have COPD and I use this medicine. Would you like to ask me any questions?
Now you'll see that particularly handsome chap down there is an image of me. That can be any image chosen by the patient or chosen by the client to reflect their product. The next thing I can do is ask anyone from a menu of questions here. If I press the first one, for instance.
It's a drug called a long-acting beta agonist. It works by expanding your airways so you can breathe more easily.
So it tells you what the drug is. What I've got here is 4 most common questions that patients ask me. So, for instance, if I want to know about side effects.
Well, like most medicines, there's potential for some side effects. You may get some tremor or your hands may shake.
But I may want to know, what does that mean for me? How likely am I to get side effects? And this is where the technology comes into its own.
Well, imagine Wembley Stadium full of 100,000 people like you. They all take iNuvitrol. 99,995 of them will feel better and stay in the stadium. 5 will have to leave because they've had some tremor or shaking. So, the chances of you feeling a lot better are very high. The chances of you having a side effect are very low, but we can't of course guarantee that that won't happen.
So what we've got there with this technology is something that answers 3 sets of needs. For the patient, it means they get clear evidence from a trusted source in layman's language to help them understand both the benefits and the risks associated with their medicines. For governments or for health authorities, it's a mechanism of empowering patients in self-care, helping them make better use of the medicines and hopefully meaning they'll take them more and have a better chance of feeling better. And for the pharmaceutical industry, there's an opportunity here, not just to talk about the side effects as they're laid out in the SPC, but to clearly lay those side effects out in the context of the benefit of the medicine. Bear in mind, this is not promotion. This is just factual information based on the SPC to give the patients more information that will help them make best use of their medicines. So, if you find this interesting, we're looking for partners to develop this further. My details will follow on the screen shortly. Please do get in touch.